Welcome to Therapy Facts with Dr. Jenn. Point number 4 about how to start therapy involves figuring out who is providing professional therapy. The number of professionals who provide professional therapy seems like it's growing every day. And it's a question that I have some challenge with keeping up with. So, for example, in my state, people who are licensed to provide professional counseling or professional therapy include, as I am, licensed psychologists, licensed social workers, licensed marital and family therapists, licensed counselors, certified psychiatric nurse practitioners, certified psychiatrists, and the list actually goes on. There are certified substance abuse counselors, etc. So, in general, professionals who are licensed to provide counseling or therapy, and I keep doing both, saying counseling and therapy, because some mental health professionals have the word counseling in their license, and they have the word counseling in their degree. We won't even talk about the degrees that can lead one to a professional therapy or counseling license, because that just gets way more confusing. But in general, you have the people who are licensed to provide mental health counseling or therapy are doctoral level, which would be psychologists, and medical doctors, that would include psychiatrists, and medical personnel, that would include nurse practitioners and psychiatric physician assistants. I forgot about them. Everybody in the field that has a license to practice therapy has either a license or a certification. So there's some sort of certification or licensure. Then there are master's level prepared practitioners, such as the social workers, the counselors, the marriage and family therapists. And so, depending upon the state that you live in, the title of these various licenses can vary just based on state. And in my state, there was a recent consolidation of master's level non medically prepared counselors and therapists. So I don't even know the details about that, but I do know that the credential is generally going to be, in terms of the number of therapists that may be available, are generally, the credential is generally going to be based on a master's level education and licensing process. And so that is why we use the word therapist, counselor, psychotherapy, because those services can come from different people with different types of licenses. I again direct you to psychologytoday.com in order to get a survey and a little bit of understanding of what I am saying for your particular state. Now, there are some professionals who are certified or licensed at a national level. So they may live in, say, Georgia, but they may have a license or a certification that allows them to practice in any state. Whereas other practitioners are only certified or licensed to practice in the state where they reside. That gets a little murky when we start talking about virtual therapy, because it doesn't matter where a person lives in order to access a mental health professional in the virtual space. And so that gets a little bit more tricky. But again, as I said, going to psychologytoday.com and going to, if you have health insurance, health insurance panel will give you a lot of information about who is licensed in your state, or who is licensed and available, and uh, who's licensed and available to be paid to see you. If you are going on self pay, which you can do, I would still suggest that you access various panels or various vetted lists of licensed therapists, so that you can be sure that you are getting someone who is prepared to do the work that you need to do. Now, you can also contact very directly the various licensing boards, and they typically have a list of licensed professionals on their website as well. So once you find out how to begin to locate therapists, then it gets easier and easier. Once you start, the process gets easier and easier. So don't be daunted by the vast number of professionals who are available to provide mental health services. As I said, hit the easy button, start with what is easiest for you, so that the process can begin and you don't get stuck at start.